After a case of tuberculosis was found at a Triad high school, you might be wondering how you can protect yourself. You might even think you've already been vaccinated against it, but actually experts say that's not the case. WFMY News 2's Hannah Jeffries joins us with a deeper dive into TB and who actually gets tested.
If you think you've been vaccinated against TB, well, you haven't, and odds are you haven't even been tested. Now, there are 3 groups in particular, and most of them get tested once a year, and those groups include jail and prison workers and people who work with the homeless, also emergency responders.
TB tends to be an infection that we usually see in marginalized populations, people who don't have a lot of access to health care, or people who are socially economically disadvantaged, because poor nutrition and poor health in general is a risk factor for getting TB if you're exposed. So a lot of these people might be in those settings, prisons, homeless shelters and such. So the people who work in those areas, we might test them every year.
Tuberculosis has been around for centuries, and according to the CDC, it remains the world's deadliest infectious disease killer. However, the disease has become both preventable and treatable.
It really isn't that big of a threat to us. If you've potentially been exposed, you get a TB test to see if your body converted. And if it did, you take medicine for 4 to 9 months, and you're done. I mean, you won't get TB. And most of the people who have somewhat casual exposures won't test positive.
Now, here's a few more facts about TB. Dr. Ohl says it isn't easily contracted. It's actually less contagious than, say, COVID or chickenpox, and only people who are in close proximity to a person with it need to be tested. If you're one of those close contact people, he says you'll get a call from a healthcare provider alerting you to come and get checked out.